or the progressive primary disease may appear during the course of initial illness or after a latent period of weeks or months. يعني after exposure, after we get the infection, the clinical feature either immediately appear or after latency of weeks or months. هذا الدايجرام يوضح لنا البرايمري pulmonary tuberculosis and the diagram of spread. Number one, spread from the primary focus to the lymph node that heal spontaneously in most cases. وبالتالي أول مكان ممكن يتأثر بالبرايمري pulmonary TB هو mediastinal lymph node and hilar lymph node. And the prognosis is good that most of them heal spontaneously. Number two is the extension to the other lung part اللي راح نسميه progressive pulmonary TB. يعني رقم واحد اكو برايمري فوكس بس اثر على الليمف نود، والليمف نود هذه اخذت وقت قصير for inflammation وبعدين heal spontaneously. هذا good prognosis. Number two هو extension to other parts of the lung اللي سمينا progressive pulmonary tuberculosis, which is worse prognosis than the number one. Number three is spreading to the pleural cavity that lead to TB pleurisy, and this can lead to TB pleural effusion. Number four, اللي تشوفون سهم هذا هو blood-borne spread. The bacilli can spread through the blood circulation, hematological spread to other part of the body, leading to extrapulmonary TB, miliary TB, or TB meningitis. فيعني اما للليمف نود تروح يكون spread or to other part of the lung leading to more lung damage, or to the pleura leading to pleural effusion, or to the through the blood leading to tuberculosis meningitis or miliary TB. We should know that there are some factors that increase risk of tuberculosis. يعني صح أقول هو exposure is the most important part, لكن not all patients exposed to infected individuals have liability to have tuberculosis. With the common clinical feature, in a few percentage of patients have self-limiting infection of self-limited febrile illness. لهذا we should know who are the patients that have high risk of tuberculosis. فهنقسمها إلى patient-related factors and associated disease. Patient-related factors that extreme ages اللي هم children and elderly have more liable to. Extreme ages more liable to have tuberculosis, children and elderly. First generation immigrants from high prevalence countries. يعني واحد جاي من مكان هو high prevalence of tuberculosis, like the East Asian countries and مثل احنا بلدان العراق يعتبر high prevalent country for tuberculosis. The close contacts of patients with smear positive pulmonary TB يعني made in the history of close contact. Close contact مو يعني for short period، وانما قد يكون يسكن نفس المكان او يعني نفس مكان العمل. Overcrowding like prisons, dormitories, homelessness. لهذا احنا هواي كان يجونا patient اللي هم tuberculosis من يصير one of the prisoners have tuberculosis, there will be epidemic in the prison of tuberculosis. Chest X-ray evidence of self-healed TB يعني previous exposure to TB increases of further tuberculosis, primary infection less than 1 year previously, and smoking cigarettes or bidis and cannabis. هذه كلها risk factors يسمى patient related factors that increase risk of tuberculosis. There are some diseases that increase susceptibility to have tuberculosis. أغلب هذه هي علاقة بالimmunity أو low immunity mean more susceptible to infection like HIV, patient receiving immunosuppressive therapy like anti-tumor necrosis factor therapy, high dose steroids, cytotoxic agent or chemotherapy, patient with malignancy, diabetes, chronic kidney disease, silicosis, and malnutrition by gastrointestinal disease. vitamin A or D deficiency, and recent measles in children. لاحظوا أغلب هذه اللي قلناها هي عبارة عن immune suppressive disease. ما عدا لا تلاحظون السيليكوزز هو disease that affect the lung lead to multiple foci that is susceptible to infection when exposed to TB infected individual. And recent measles in children as the same mechanism. Those patients have more susceptibility to have a tuberculosis when exposed to infected individual. يعني احنا الاكسبوجرز امبورتنت فاكتور، لكن اكو نسبه معينه من البيشنت اللي هم اكسبوزد ما يساعدهم كلينيكال tuberculosis، واللي يساعدهم clinical tuberculosis may have risk factors. One of these risk factors either patient related or by disease related factors. The diagnosis of primary tuberculosis is very important to prevent complication. لاحظوا هذا الجدول مثلا what is the natural history of untreated from 3 to 8 weeks after primary tuberculosis. There will be just primary complex اللي هو يتكون من lymph node and the lung mass and positive skin test. While if patient was not treated for 3 to 6 months, there will be meningeal TB, TB meningitis, and miliary TB راح نتكلم عنها بالسلايدات القادمة, and pleural disease. And up to 3 years, patient have extra pulmonary TB in the gastrointestinal tract, bone, joint, and lymph node. And after 8 years, patient have that poor prognostic renal tract disease. And from 3 years onwards, can patient have post-primary disease due to reactivation or reinfection. هذه كلها complication هناخذها واحد واحد هنا. إذا هذا the early diagnosis and early treatment of the primary tuberculosis is very important to prevent complication اللي هي extra pulmonary TB or reactivation of primary TB. Starting with miliary TB. Miliary is a term that derived from the word millet seed. يعني تعني حبوب هذه البذور من البذور. فيعني it's derived from the X-ray appearance of patient with miliary TB. تطلع شلون حبوب صغيرة بالإكس-راي disseminate all over the lung fields. هذه يسموها miliary tuberculosis. اسمها مشتق من صورتها بالأشعة. It is blood-borne dissemination that gives rise to miliary TB. 2 to 3 weeks of constitutional symptoms and dry cough. Patient may have hepatosplenomegaly, may have meningitis, and they may develop severe headache, and bone marrow also may involve that, leading to anemia and leukopenia. It is a blood-borne dissemination. وبالتالي many organs can be affected in miliary TB, but most commonly the hepatosplenomegaly, the central nervous system, and the bone marrow. Post-primary TB يعني it's either indicating exogenous new infection. يعني واحد اللي كان primary tuberculosis have exposure positive patient and have new evidence of tuberculosis. هذا new أما يكون هو it is really new infection called exogenous, or it is reactivation of dormant primary lesion. dormant يعني ساكن أو خامد. يعني البرايمري انفكشن اللي صار عند المريض اللي اعتقد انه راحت اعراضه وما راحت، اللي اعتقد انه healed, sorry, it was not healed, وانما it is become a dormant, خامل جامد, and later on by any event like immune suppressive drugs, immune suppressive disease, it was reactivated and called endogenous post-primary pulmonary TB. It is mostly affecting the lung and usually affects the apex of the lung, because in the apex the oxygen is predominant, and this is important for this Mycobacterium tuberculosis, which is strictly aerobic microorganism. يعني مكان اللي أكثر مكان احنا إن من يجينا مريض chronic cough and we have suspicion of TB ونشوف الاكس راي مالته نشوف there's apical consolidation apical mass بس نجيب بالنا انه هذا most likely to be tuberculosis because this is microorganism which is strictly aerobic and depend on the oxygen, so it is mostly survive in the apical part of the lung. The onset usually insidious and over several weeks, may have systemic symptoms, fever, sweating, malaise, anorexia, and usually these systemic symptoms accompanied by progressive pulmonary symptoms. Yani, the systemic symptoms is very important part in tuberculosis, but absence of systemic symptom should not exclude TB. يعني نلقى واحد عنده high grade fever, especially nocturnal, drenchy sweating, fatigability وفكر انه هذا فعلا this cough is related to tuberculosis لكن عدم وجود systemic symptoms not exclude TB. هذه ملخص الاكس راي findings in patient of pulmonary tuberculosis. مكتوب طبعا هذه مكتوبه differential diagnosis ما مطالبين بيها بس مطالب تعرفون انه the X-ray findings is okay, maybe there's cavitation, consolidation, miliary شدوا ونقلح هاي النقاط اللي مساكنه اللي سميناها miliary TB due to blood-borne dissemination like millets مثل البذور and pleural effusion or pleural empyema. Empyema تعني there is purulent pleural fluid. This table represents the clinical representation of pulmonary tuberculosis. Chronic cough often with hemoptysis, قد يجون pyrexia of unknown origin, unresolved pneumonia واحد يجي على شكل chest infection with multiple course of antibiotic and did not improve, exudative pleural effusion. Maybe the patient is asymptomatic totally and diagnosed only on chest X-ray, هذا راح نسميه بعدين. And this patient have silent pulmonary tuberculosis, weight loss and generalized debility and spontaneous pneumothorax. لاحظوا there is variable presentation of tuberculosis, and in a region of high prevalence of TB we should have a low suspicion. خاصة احنا مثل the dentists and the doctors are in contact daily with those patients. Complications of chronic pulmonary tuberculosis. Patient with pulmonary tuberculosis was not treated will lead to complication. مثلا أخذنا complication of primary tuberculosis هذا اللي هو post primary tuberculosis. The pulmonary complication like may lead to massive hemoptysis, core pulmonal fibrosis, atypical mycobacterial infection. يعني this infection of tuberculosis will be focused increase susceptibility to other infection, lung calcification, aspergilloma, it is fungal infection, obstructive airway disease, bronchiectasis, and fistula on the lung. Then, non-pulmonary complications may lead to laryngitis, anorectal disease, empyema, amyloidosis, and Ponson's polyarthritis. It's variable and include pulmonary and extrapulmonary. يعني تحاولوا تفهموا انه it is pulmonary and extrapulmonary. ماكو داعي تحفظون هاي التفاصيل هواية. الاكسترابulmonary feature احنا هنحاول نلخصها بهذه كم سلايد مثل زبدة the most important extrapulmonary tuberculosis. They account about of 20% of cases. يعني إذا 20 من مرضى التوبركلوسيس هم diagnosed initially as or later as extrapulmonary TB. وبالتالي كل مريض tuberculosis have a 20% rate of being have extrapulmonary tuberculosis. It is هذا نتكلم كلام عن المرضى اللي هم HIV negative, but in patient with HIV or AIDS have more liable to extrapulmonary tuberculosis. The first one is lymphadenitis. It is the most common one of extrapulmonary TB. Sometimes there be caseation and liquefaction. This caseation and liquefaction being converted to a soft abscess, and this called collar stud abscess. هتكلم عن especially abscess in the neck, in the cervical lymph node, and this abscess sometimes rupture, leading to discharge and sinus formation. Number two, gastrointestinal tuberculosis. Uh, the mostly is ileocecal disease, which account about for 50% of gastrointestinal TB. It's characterized by fever, sweating, anorexia, weight loss, and have mass in the right iliac fossa. لهذا some patients with tuberculosis present only at initial presentation with fever and right iliac fossa mass or right lower abdominal mass. The number two is tuberculous peritonitis, which characterized by abdominal distension, pain, and constitutional symptoms. Those patients usually have ascites, abdominal distension, because of TB affection of the peritoneal cavity. Number three, pericardial disease, either causing pericardial effusion or constrictive pericarditis. Central nervous system disease, usually causing tuberculous meningitis. Bone and joint disease, usually affecting the spine. Those patients present with chronic back pain with fever only, and this spine disease that caused by tuberculosis called Pott's disease. In addition to the spine, TB also can affect many joints in the body, but usually it's involved the hip joint or knee joint. وبالتالي any chronic unresolving arthritis of the spine or the other joint, we should think about tuberculosis as a cause, especially we are in endemic area of TB. Genitourinary disease, TB in the genitourinary tract can cause hematuria frequency, dysuria, and can cause sterile pyuria. لهذا sterile pyuria يعني واحد عنده feature of UTI and have pus cells in the urine examination. من دز على urine examination, there is pus cells, but when culturing the urine, the culture become negative. يجيك يعني اللابراتوري يدز لك النتيجه يقول لك هذا culture negative, there is no microorganism. نسميها sterile pyuria. ليش؟ لأن because tuberculosis require specific culture media different from the usual culture used for the bacteria, like gram negative and gram positive microorganism. لهذا ما يطلع الكلتشر بهذا اليوجوال كلتشر ميديا، يطلع نيجاتيف كلتشر سميناها ستيرايل بايوريا. هذه الصورة تمثل the summary of the extra pulmonary TB. ممكن ما لاحظوا مثل ما قلنا بالبداية it is not pulmonary disease وإنما it is systemic disease. can affect many organ system. كان meningitis, can have back pain, abdominal mass, canine pulsing, lymph node affection, pericardial effusion, ascites, hematuria, arthritis. Importantly, now should know how to investigate those patients and know if this patient with pulmonary or extra pulmonary symptom having TB or not. Commonly, the pulmonary, we should think of TB when patients have unexplained cough for more than 2 to 3 weeks, especially in the region where TB prevalent like our country, or typical X-ray or CT changes of tuberculosis. Investigation include direct microscopy of the sputum smear. It is the most important first smear. يعني ناخذ the sputum sample of the patient and we do direct microscopic examination. Importantly, we should take at least 2 samples, and first sample or the one of the samples should be at least sample taking in the early morning. يعني اول ما يقعد المريض من النوم نعطيه احنا مثلا يجي المريض جانا مثلا نقول له هذه containers or تخلي بيها the first sputum sample in the early morning. There is previous used Zellnerson stain كان هو common stain using to staining the sample to see the mycobacterium, لكن it was replaced now by the most specific and the most sensitive stain called auramine staining by using fluorescent microscopy, not the light microscopy. هذه الاكس راي مثل الاكس راي of the tuberculosis. لاحظوا bilateral upper opacities، هذه نسميها consolidations. هذه المكان هذه اللي تشوفون البياض اللي موجود بالاكس راي الابر بارت مثل consolidations. ولاحظوا اكو في داخل هذا البياض اكو مكانات هي there is darker than the others، مثل شلون الفتحات فراغات سوداء. هذه فراغات سوداء هي represent cavities, and the cavity in the X-ray indicate active tuberculosis. So diagnosis of tuberculosis involve two important parts. Firstly, we should take the specimen. احنا تكلمنا عن السبيوتم because قلنا لانه the most important tuberculosis هو pulmonary tuberculosis. لهذا اخذنا السبيوتم، وعشان ناخذ السبيوتم لازم يكون early morning sample and at least 2 samples and using fluorescent microscopy, which is more sensitive than the previously used light microscopy. In case of pulmonary TB, the samples required usually the sputum. إذا ما يقدر cannot give sputum, the sputum should be induced with nebulized hypertonic saline. If cannot give sputum, sometimes need to bronchoscopy and washing and take the sample from the lung directly, or by gastric washing, mainly for children. Regarding to extrapulmonary TB, we need fluid samples from the affected side in case of مثل central nervous system, cerebrospinal, or ascitic, or pleural, or pericardial, or joint. عادة اليلد يعني حتى إذا أخذنا سامبل من هذه الأماكن ودزيناه for examination ما نتوقع اليلد عالي، يكون لازم يلد is very low، لكن we should do it even the low yield because it's important diagnostic. إذا طلع positive نقول it is tuberculosis، إذا طلع negative نحتاج more further specimens by tissue biopsy. Example from bone marrow, liver, and this may be diagnosed especially in disseminated tuberculosis. فاحنا هسه اخذنا السامبل سواء كان من البلمونري or extra pulmonary. Next step after the sample collection is the diagnostic test. شو نسوي السامبل هذا؟ نسوي له analysis by قلنا either by using special stain اللي هي Zolnilson or amine fluorescence stain, or by using better than the staining and microscopy nucleic acid amplification اللي هو البي سي ار، مثل ديسون هسه بالكوفيد بي سي ار polymerase chain reaction، or by culturing. بلاحظوا الكلتشر اللي موجوده it is a special culture media like salt media and liquid media. لهذا الكلتشر العاديه اللي هاي يستخدموها المختبرات حاليا من تاخذ انت فد abscess sample or pus sample وتدزها تقول for bacterial culture، هذا ما تفيد، ما طلعت tuberculosis. لا نحتاج لازم تقول له من تاخذ السامبل I need this sample to be cultured as tuberculosis. There is a special test in the pleural TB called adenosine deaminase. If it is high indicate pleural TB. لاحظوا اول نقطه بالدايجنوستيك تيست هو احيانا called tuberculin skin test. tuberculin skin test هناخذه بالسلايدات القادمه. هلا نفس التيست حتى تشوف بليتنت تي بي it is have low sensitivity and specificity used only in primary or deep infection. يعني شو low sensitivity and specificity؟ يعني اذا طلع بوزيتيف مو شرط صحيح بوزيتيف، واذا طلع نيجاتيف مو شرط صحيح نيجاتيف. We should have high clinical suspicion. لهذا شو يقول used mainly in primary TB or deep-seated infection and in countries without available other methods. احنا حاليا in Iraq عندنا multiple centers وبيها culture media وبيها nucleic acid amplification اللي هي بيها PCR. لهذا ماكو شيء اسمه نستخدم tuberculin skin test to diagnose tuberculosis. In addition to diagnostic tests, we have baseline blood tests like blood count, C-reactive protein, erythrocyte sedimentation, ESR, urine electrolyte, and liver function tests. These tests يسمى general investigation اللي هي non specific investigation. يعني إذا لقينا واحد بيش دي صار مالته أو شيء activity high, this could indicate TB if هذا suggestive clinical feature, but they can elevate it in a lot of clinical infection or inflammatory disorders non specific. فالمهم عندنا collecting the sample, staining the sample, doing PCR and culturing the sample. وعندنا special test for pleural TB called adenosine deaminase. واخر شيء اذا based on high suspicion of tuberculosis and we have no confirmatory test, يعني ولا واحد من هاي التست سويناها طلع positive, but I have still a high suspicion, especially in a prevalent country like our country, we should give anti-TB trials. فشنو كاتب جواب؟ كاتب response to empirical anti-TB drugs usually seen after 5 to 10 days is diagnostic. يعني انا كان عندي suspicion وسويت اخذت السامبل سبيسيمن وسويت له diagnostic test negative, but I still have suspicion. I suspect this case a tuberculosis because of the serious disease. There's a rule of empirical, يعني انطي treatment واشوف الريسبونس. اذا صار response ورا 5 إلى 10 ايام this is called diagnostic therapy. يعني انا اقول this patient have tuberculosis despite the sample collection test was negative because the patient is responded to anti-TB after 5 to 10 days, called therapeutic diagnosis. We diagnosed tuberculosis. We know we should start treatment. The most important treatment regime include HRZE. لاحظوا هذا المربع الجوي H mean isoniazide and R rifampicin, Z for pyrazinamide and E for ethambutol. These 4 drugs are the important drugs that used in treatment of tuberculosis. هذا هو WHO World Health Organization recommendation for TB. The standard regime is using 2 months 4 drugs and 4 months 2 drugs, or using 2 months of 4 drugs and then 4 months 3 drugs. إذا كان اكو بلدان بيها INH isoniazide اللي هو حرف الاتش هذا resistant عليه ممكن نعطي، فما ممكن نعطي 2 شهرين 4 ادويه و4 اشهر 2، او نعطي شهرين 4 وال4 اشهر الثانيه نعطي 3. المجموع يكون هو 6 month duration of therapy. هذا بالنسبه للديوريشن. بالنسبه للفريكونسي the optimal frequency giving daily tablets. طبعا التابلتس هذه موجوده اللي هي مال those 4 drugs available now in single tablets. زين. The optimal therapy giving daily, but sometimes because of poor compliance and poor adherence of the patient هسميه شو نسميه بعدين directly observed therapy. اكو ممكن نسوي modification، ما كمان نعطي daily therapy، نعطي daily the first 2 months بعدين 3 مرات بالاسبوع ل4 اشهر اللاحقه، او من البدايه نعطي المريض 3 times per week dosing to ensure compliance and adherence to therapy. فإذا الفترة هي 6 أشهر ثابتة. أما الفريكونسي of treatment optimal هو daily treatment، لكن we can modify in patient suspicious of having poor compliance or poor adherence to therapy. Control and prevention is the most important of each infectious disease or called community acquired infection disease. احنا نسمي التي بي يسمونه community acquired infection disease is to prevent more TB episode because more case كل case index case lead to مثلا to 10 cases and this 10 case can lead to more 100 cases and such on، مثل ما دا يصير حاليا بالكوفيد 19 era. There's because of this high epidemic virus the index case to many cases and thousands of cases within a few days. The most important one is detection of latent tuberculosis. شنو يعني latent tuberculosis? Individuals that harbor the bacteria and remain, they did not develop any sign of active disease and non-infectious. يعني هو أخذ التوبركلوسيس والتوبركلوسيس استقرت and become dormant. dormant يعني ساكنة خامدة، ما عنده أي ساينز، لا سيستميك ولا اكس راي ساينز. لكن هذا بالمستقبل لو عنده لا سيستميك ساينز والاكس راي نورمال والسي تي سكان نورمال، لكن still at risk of be reactivated later on. لهذا we should treat this patient to have latent TB. والcontact tracing is a legal requirement in many countries. contact tracing يعني انت اذا شخصت كل مريض tuberculosis نسوي contact tracing كل الcontacts with this patient with this index case should be examined for latent tuberculosis. إذا latent يعني the patient have the microorganism, have positive test, but the patient is no symptoms, no signs, and no radiological features. This patient could be reactivated later on, could be have latent TB, could have active TB later. So نقطتين: contact tracing of any active TB, and we should diagnose latent TB by either tuberculin skin test or using IGRA test. هذا التوبركل سكين تيست اللي هو تشوفون هو intradermal injection of PPD purified protein derivative on the inner aspect of the forearm. يعني هذا هو عبارة عن tuberculin extract. هاي المادة اللي هي PPD tuberculin extract ماخذة من التي بي وتنحقن intradermally, and the reaction is read after 48 to 72 hours. If it is more than 5 millimeter, it's called a positive test. And this patient اللي هو ما عنده لا symptoms ولا signs ولا radiological feature of TB وطلع عنده positive test هنسميه latent TB and should receive treatment. treatment يختلف عن treatment of active TB. لازم ننتبه انه التوبركين سكين تيست may have false positive in patients would have BCG vaccination لمعادة الأطفال or by non-tuberculous mycobacteria, and false negative patient in patients have immune suppressive by a disease or by drug. السكند تيست اللي هو IGRA called interferon gamma release assay اللي هو from sensitized T cells that responded to antigen of tuberculosis is more specific than skin test. هذا new novel diagnostic test. هذه ماكو داعي تكون تفاصيل. هو ياخذ اما من ال purified lymphocyte directly examined or by examining of the whole blood directly called IGRA. It is more specific than skin test. يعني بس تذكروا احنا قلنا اكو false positive and false negative. هذا لا، هذا ما بي false negative false positive. positive يعني positive ونيجاتيف يعني نيجاتيف. فبالتالي ان latent TB هم asymptomatic contact who test positive but have normal chest X-ray can be treated with chemoprophylaxis to prevent infection from progressing to clinical disease. هذا السطر الأول هو تعريف latent TB. asymptomatic contact test positive normal X-ray should receive treatment. اللي هو لاحظوا أما ياخذ 2 drug ريفامبيسين NH for 3 months تختلف عن الفترة اللي قلناها بالبلمونري TB اللي 6 أشهر، هاي 3 أشهر فقط، أو ياخذ single drug اللي هو isoniazid for 6 months duration. تكلمنا عنه هو direct observing therapy المرضى اللي هم اني بصوره عامه مو بس التوبركلوز، اني بكتيريا the poor compliance lead to resistance to drug resistance. وبالتالي we should ensure compliance to avoid emerging of drug resistance and to ensure treatment of this serious disease. directly observed therapy DOT اللي هو ما كمان نعطي daily dosing، نعطي الدوز 3 times per week to improve adherence. This recommend for patients اللي هم like homeless people, alcoholic, drug users, mental disorders patient, or patient have previous history of non-adherence and treatment failure. كل مريض تحس انه هذا non compliant انطي دوت ذاك observed therapy دوت. طبعا تكتب على كارت المريض من يراجع المركز هذا مريض دوت بيشنت، يعني هذا وقت المركز ما يجهز الدراجز رجيم ويفهميه على 3 ايام بالاسبوع، ما كان ما ديلي رجيم. And lastly, the vaccines, the common vaccine that known as the BCG vaccine. It is a live attenuated vaccines derived from Mycobacterium bovis and is the most established vaccine. كلكم سامعين بالبي سي جي اكيد. هو usually give for the pediatric patient, sorry, for the children's. It is administered by intradermal injection مثل السكن تيست intradermally مو subcutaneously. It is the efficacy. المشكلة هنا بالبي سي جي vaccine it is effective in prevent disseminated disease and meningitis in children, but efficacy in adult is inconsistent. لهذا ما سمعونا احنا في اليوم لقحنا بي سي جي for adults. This vaccine is proved to be effective in prevent disseminated disease and meningitis in children, while its efficacy in adults is inconsistent. لهذا still they have issues and they have trials to found new vaccines to prevent tuberculosis in adult. لكن اللي ما يجي يشجع الموضوع هذا ان هم البلدان اللي هم they have the power to produce vaccines, they have no tuberculosis. يعني احنا البلدان اللي بيها لا زال tuberculosis prevalent هو اللو بلدان العالم الثالث، هو اللو social countries. لهذا هم ما مشغولين هواي انه يسوون vaccines to prevent tuberculosis, to prevent disease while it is not present in their country. بينما لاحظوا انه بالكوفيد فاكسين ايش صار التوبركلوسيس صار له سنوات، بينما الكوفيد 19 قدروا خلال سنتين يكتشفون اللقاح because this disease involved their countries. Contraindication to vaccine مثل ما قلنا هو live attenuated. ما دام live attenuated معناته we should not give this patient vaccine to immune compromised patient like HIV patient or pregnant patient. ما يصير ننطي live attenuated vaccine because this may be reactivated and lead to clinical infection. المحاضرة انتهت لهنا. منو عنده سؤال للطلاب؟ Any question? Any question? أي شيء ما واضح بالمحاضرة؟ No question? Thank you so much for listening.